The role of emergency department staff and the interaction of orthopaedic teams with emergency department staff is obviously crucial to the patient's experience when they first arrive in hospital. Over the years, the Royal College of Emergency Medicine has run its own audits of the care of people with hip fracture, and to some extent those have been complementary to the work of the NHFD, but they have given slightly mixed messages between the two. And in 2023, the College of Emergency Medicine, the Scottish Hip Fracture Audit and the National Hip Fracture Audit sat down and came to a view as to how we should collaborate, and a consensus developed out of that. And central to that was an adoption of an acceptance and adoption of the Scottish standards for hip fracture care by the College of Emergency Medicine and the NHFD. So 6 elements of emergency care that should be provided to patient when they first present in the ED. One of the things that was advocated in the Scottish audit and is now standard within the National Hip Fracture Database is the patient should be screened using the prioritise score to identify delirium. We're all aware of the fact that delirium is very common, the commonest complication of hip fracture surgery. But actually, 2/3 of the delirium we see in this population is there when the patient first presents to ED, and understanding that, anticipating that, and responding to it in the way that patients are looked after subsequently is key to their experience in hospital. So 4AT screening as part of ED care is something that the hip fracture services are pioneering, but is obviously key to the care of patients with all sorts of other medical conditions. The other thing that EDs have been hugely involved in is the provision of pain relief, and not just analgesia, but the use of fascia iliaca blocks is something that ED staff have been driving, providing, and more importantly in recent years teaching other people to do, so that everybody involved in the care of people with hip fracture can give a block in ED or in the ward, or when surgery is delayed the next day on the ward, to avoid the need for excess opiates. So we have now created a tool which allows staff in the ED to run a very simple audit of the quality of simple care across these 6 domains. The tool is there on the RCEM website and worth having a look at. The NHFD website will allow you to look at performance charts, and if you click on the length of stay run chart, you'll see that there's a new red line appeared at the bottom of that. And that line is there to try and capture the amount of time that patients spend in the wrong place. It's not just time spent in the emergency department. We didn't want to push people to be moved straight from the emergency department to get them somewhere, anywhere out of the department. So what that line captures is the amount of time patients spend in the wrong place, be that still in the emergency department or moved to inappropriate wards rather than orthogeriatric or orthopaedic wards specialising in their care. So if you put your name of your hospital in, you can look at the extent to which patients are spending time in places that are not really geared up to their perioperative and early rehabilitative care. And again, that's worth looking at for your hospital. And all of the topics that I've mentioned were rolled together into the focus 2 of the annual report of 2023. And what we've developed here is a key performance indicator 0, the first in the set of 8 key performance indicators the NHFD has. And what that's trying to measure is the proportion of patients who are made comfortable promptly. And by comfortable, we mean that they've had a nerve block, be that in ED or on the ward, but they are in an appropriate orthopaedic or orthogeriatric ward in a proper bed, surrounded by the MDT who will be looking after them in the pre, the peri, and the post-operative period, and can get on with multidisciplinary working in the full orthogeriatric model. And the proportion of patients who are achieving all of that within 4 hours is being logged. As you can see, the performance across the country is extremely poor, or was extremely poor when we first brought this out in 2023, and we look to see substantial changes in that in response to this as a driver for quality improvement in the time ahead. One of the ways in which that can be achieved is by implementing a fast-track protocol so that ambulance staff might indicate that somebody's coming in with what they believe is a femoral fracture. Staff in ED can fast-track the patients through initial triage to make sure that the x-rays are performed promptly. The bundle of 6 things from the Scottish audit is performed as quickly as possible, and then the patient's assessed quickly by the orthopaedic team before they can move from the ED, where there is easier access to medical registrars, cardiology and other emergency services. And with a protocol like this, which is downloadable from the NHFD website, you can make dramatic changes. In my hospital, we saw a change from essentially nil to more than 50% of patients getting to the ward within 4 hours. And for many of those patients, that meant they were being admitted to hospital a day earlier than they previously had been, and having surgery a day earlier than they had been. So it's a really worthwhile resource to have a look at. And then once you've done all of that, you can go back to the website and you can see in real time how your figures improve.